Good morning, ma'am. I am your student nurse for today. My name is Mary Chris Bantillo. May I know your name?
Mrs. Aquino.
Okay, Mrs. Aquino, today I'm going to perform the postpartum head-to-toe assessment. The postpartum nursing assessment is an important aspect of care in order to identify early signs of complications in the woman who has just given birth. Following pregnancy, the woman is at risk for infection, hemorrhage, and development of a deep vein thrombosis or DVT.
Check the breast, and if the patient feels heavy or her breast is full of milk, and if it feels normal and hasn't experienced any changes yet. To assess the breast, use the back of the hand and feel if it's cool or warm or hot to touch. The skin condition might look like orange peel, or it has a stretch mark and appear like smooth. When assessing the mother's nipple, there are three different types: the everted, where they're sticking out; the inverted, where they are concave, kind of go in; and the flat, when they're unable to become everted, like unable to become inverted. Next, let's proceed to the fundal check. Expose the abdomen of the patient and use the two hands for fundal check. One is to support the bottom of the uterus, and the other is to actually feel for the fundus. Go where the fundus is supposed to be. If the patient just delivered, it should be in the midline, which is the middle of the stomach, and it should be at the level of the belly button. That's where we're gonna go, and if it's there, it's good. There are three different types we describe the fundus. First, the firm with massage, and boogie. Firm feels like a tennis ball. Firm with massage feels like a little squishy, and if you rub on it a little bit, it starts to firm and it gets hard. For boogie, it can cause a hemorrhage, and it is bad. It is kind of squishy thing. Let's continue to the vowel sounds. Moving to the hot vowels, just like everybody else, in the head to toe, we're gonna do all the sounds and we're gonna listen. There's no reason why a postpartum woman who delivered a normal vaginal delivery would not have vowel sounds. Spinals do not impact the vowels, and neither do epidurals. If the patient had to have C-section and was under general anesthesia, then yes, she might have hypoactive or absent vowel sounds for a short period of time. But if this was a normal vaginal delivery, even she had enough durals, that's not gonna affect the patient vowel sounds, and they should be active and normal. Next, let's describe the different types of leukia and how do we assess the episiotomy and the assessment of human sign to check the DVT. Leukia is a vaginal fluid, and there are three different types of leukia: the leukia rubra, the leukia cirrhosa, and leukia alba. The leukia rubra, it is expected to a newly delivered patient for the first 3 days after delivery, and it's kind of bright red blood. In leukia cirrhosa, it's the darker brown color with an all blood appearance. In leukia alba, which is like yellowish or whitish discharge. Next, the episiotomy or laceration. First thing to do, if there are bruising, swelling, discharge, or drainage, you have to check that. Then we can change the patient pad. and keep an eye on everything and move to episiotomy. Most women do not get episiotomy anymore, and it's not common practice. But if she does have an episiotomy or laceration in the first, second, third, or fourth degree tear, we have to assist that. Expect that there are some normal redness or maybe slight edema or maybe some bruising from a laceration. That's okay, we expect that. If it's over and beyond our explanation, then that's a little bit concerned. There shouldn't be any discharge or drainage. You shouldn't be able to see the stitches, the opening, or anything like gas. The tissues are properly sewn together, or they should be touching. If you see any bleeding, that's not approximated, and that's not good. And we make sure the episiotomy or laceration is very approximated. Next, we are going to discuss the Homan sign. Homan sign is to check the DVT or the deep vein thrombosis. The way we do that, expose the patient leg and support behind the knee with your hands. Take the foot and then we're gonna sharply dorsiflex it back and ask if there's any pain or tenderness in the calf. The patient could say yes, which might be indicated to positive Homan sign, or maybe there is a DVT, or she could say no, which is negative to the Homan sign, and do the same on the other leg.